So good evening, namaste to all our Evexious family members. So Dr. Mukesh, you must be knowing all of them from Mumbai and Pune, but this is a program which is across the country. So we have our members joining in from Ahmedabad, we have our ambassadors joining in from Singapore, because this is a very interesting topic. We have our members joining in from Kolkata to listen to you today. And as you see before the program only, everyone is so excited to talk about this vaccine, not only about what's going to happen with the COVID one, but also the general awareness and access towards the senior citizens vaccination. That is something which is very important, which we want to learn from you today. But Dr. Mukesh Budhwani is a senior consultant physician from Apollo Clinics, Pune. He has been practicing over there for many years now. Dr. Mukesh is also one of our panel physicians on home health solutions. He primarily takes care of our Mumbai and Pune members. So thank you, Dr. Mukesh, for taking out this time today and joining us. I would like to hand over the session to you today. So you can share your screen. So for our members, anyone has any questions, you can just keep a note of that. There is a chat box where you can put up the question, or if you have any specific question to ask, so you can always unmute and ask Dr. Mukesh. So
You're able to view
over to you, Dr. Mukesh.
my screen. Is my screen visible? My screen.
Sorry.
You're able to see my screen.
Yes.
Yeah. Okay. Yes. Good evening, everyone. Yeah, this is Dr. Mukesh Budhwani. I'm a consultant physician and I have a fellowship in diabetes. My practice is more focused on geriatric medicine, and diabetes, which is more of an endocrino. I have a special interest with diabetes and geriatric medicine, where I take care of a lot of my senior citizen patients uh, uh, through home healthcare. I am associated with Evictious Home Care Healthcare from its foundation day, and definitely we always try to provide the kind of information and treatment which definitely gives a different kind of insight. Especially we have focused on the geriatric and kind of elderly age, we don't call geriatric, elderly age patients, where they are always keen to get some more and more information, okay, for their health, for kind of precautionary health. We say always prophylactically health, because what happens is they are always on the burden of medications. They go to doctor provides prescribes lot of medications, but the only focus from our side, we have always tried, instead of medications, what other things they can do to make themselves healthy. So then they should not be taking a lot of medicines, maybe today or maybe in future. So to take that focus to that consideration kind of thing, today we are specially designed for our elderly patients is like adult vaccination or adult immunization. Everyone is aware of vaccination for kids. Everyone must have been taken, but then in this years, the course of vaccination, the chart for vaccinations has changed. Lot of vaccinations in my childhood, they were not there, mandatory kind of thing. Maybe it would not be there in your also, but then what happens is, as we were never aware, or our physician never told us कि when we are adult, when we cross age 50, we need to take a lot of other vaccination. So to provide such information and to discuss on that part, today we are going to start a topic on adult immunization. See, basically, I just want to tell that vaccination are not just for kids. So that it is, because see, this is not the first time I've been presenting this to my patients or maybe seminar, and I came to know that after the seminar they came to me that we were never aware of there were any vaccinations for adults also. So this is where I found this is very important to discuss on that, to get the insight that really the vaccinations are not only for kids, they are very important even for adults. And in, I can say kids, they can, if they for kids, if in case they skip any of the vaccine, some vaccines during their childhood, they can still go ahead and take it in their adult, when they are youngsters, when they go old, when they cross 35, they can still take it. So how important it is when we at our young age or adult age or elderly age, which vaccines are important, why they are important. So we will discuss on this part. See, everyone is aware what is vaccines. I think so. I don't want to think, but vaccines are something which actually protects us from any kind of disease, or in case if you are infected with that virus or
उसमें
bacteria.
नीचे वो करो joined with audio.
Yeah. So vaccines are what are vaccines? Vaccines are there if in case you are infected with any kind of bacteria or virus, you are already protected from that virus or bacteria. So if you have taken that vaccine, your body actually releases that kind of antibody. Antibody is something which fights with the antigens. So your body already have some kind of developed antibodies. So suppose if you are infected with that same kind of virus or bacteria, your body directly releases the antibody and fights with that viruses or bacteria, and you don't suffer from that disease, and in case you don't require any kind of treatment from that disease. The most important part is you save yourself from medication, you save yourself from suffering, you save yourself from hospitalization, and definitely there are a lot of vaccines which actually, if in case you suffer that diseases, it can lead to mortality. So it is basically life saving, and anything which is life saving actually is very important for us. So why should we not be aware of that kind of information? Why should we not take the benefit of that things? If it is life saving, why should we not take benefit instead of eating a lot of medicines, instead of suffering and going to hospitalize and spending a lot of money when you get infected? Why not spend little bit of money and take vaccines in advance? So, like there are some vaccines which, if in case everyone is aware, smallpox was a disease which got eradicated in 1978 from India. So, how it got eradicated? It was the mass vaccine, mass immunization was done since years. Polio is almost on the eradication part. We can't say it is completely, but definitely it is almost eradicated due to the every childhood, during every childhood is getting that vaccine. So vaccines are so much beneficial in our life, because once you are infected, like with polio, people are aware it's a lifelong disease. So a small vaccine, on time vaccine, saves you from lifetime disease. So there are so many vaccines, so many diseases which we are going to discuss today. Only thing is, before we start on the names, on what vaccines are there, we need to understand that why are we today discussing on adult vaccination? Or are you people aware that there are adult vaccinations? Are you people are everyone is aware that we need to take some vaccination on time to time before we get infected, or before you say, I am so well, I am so perfect, I don't have any issues, why should I take vaccine? So vaccines are there that you don't suffer. So why adult immunization, or why adult vaccination? So for whom it is important? So the information which I am to say, people have to say why it is important, who can avail this benefit of adult vaccination. So it is dependent. So these vaccines are based on the success on the infant and childhood immunization program. So vaccines have always showed us that children who have been vaccinated, they have not developed that diseases. So or people who have not taken vaccines in their childhood, or they can take it as a booster, and especially new vaccines are on the target. So when we were in our childhood, the vaccines which we have not taken, the vaccines which were not there when we were children, when we were small kids, when the vaccines जो नहीं थे, वो vaccines हम अभी ले सकते. See, I'll speak in both language. I think so it will be easier. I hope everyone is okay with the English, or should I be talking in Hindi also?
No, Dr. Mukesh, I think English is good.
Acha, English is good, fine.
Yes, yes.
So yeah, good, good. So thank you very much for that. So yeah, so if in case as everyone starts aging, they are more susceptible to disease. That means they are more at a risk of getting a disease. Disease can see tuberculosis. We are still not eradicated. Government is trying their hard, but BCG vaccine is given on the second day of on the second day of birth. So that vaccine helps you to give you precaution lifelong from tuberculosis. But earlier there were many people who did not take the vaccine. They suffer from tuberculosis. India is still fighting with the tuberculosis. The deaths compared to COVID, the deaths of from tuberculosis is still more than as compared to COVID. But still we are fighting since years. Our doctors, we have been trying to provide the information. So this is important. There are a lot of vaccines which we have taken in our childhood, but the vaccine, the strain of the vaccine has changed. The antimicrobial resistance have changed of the vaccine. So sometimes what happens is, if you have taken a vaccine, but the virus have changed their strain, so you are not able to, kind of save yourself completely from that disease. That is why adult vaccination is very important. And definitely why it is important, because as government and doctors have made it mandatory for the newborn, the vaccines has to be taken. There is no mandatory program by the government for the elderly people has been done, especially in India. I'm talking about India. It is there in many developed countries. It is there in European countries that the program of adult vaccination is mandatory. But this kind of program is not been run by the government, that in India adult vaccination is mandatory. But I, as a physician who have been practicing since more than 18 years, I have found how much vaccines have been beneficial for adults. Because suppose some vaccines, some deaths like pneumonia, some deaths, there are deaths from influenza viruses, there are deaths from swine flu. So the vaccine which we take for flu actually covers the swine flu. So there have been deaths from swine flu. So we have a lot of vaccines. So today we are going to more discuss why should not we take that benefit of that adult vaccination. It does not. I know in American countries, European, it has been provided by the government program. It has been sponsored by the government or the insurance program. The vaccines have been sponsored. In India, it is not sponsored. Definitely, I know that is where the problem lies, because government can't make it mandatory, because the everyone does not have the capability to pay for the vaccines. So government can't make it mandatory. But definitely we doctors can provide. That is why we are here. Actually, we thought, why not we spread that information from our end for the service towards our patient, that how important for you it's to take a vaccine, or there are the protocol of vaccines, follow
अबे
the
अंदर
protocol of
जा
vaccine.
लेट के बैठ जाएगा तो फिर बेकार
Yeah.
है
So to take it forward, what are the so today I'm there. There is a different kind of program from European and American medical association, but we'll not discuss on that. What adult vaccinations are recommended in India? So I'll just list it, and slowly I'll try to give you in brief. I will not go into too much of medical knowledge, but I would just provide the what basic vaccines are required, what vaccines are for what, and then at the end I will try to solve your queries if in case you have, according to in case of any individual vaccine. So the vaccines which are recommended in India is influenza vaccine, which is flu vaccine, hepatitis B vaccine, varicella, meningococcal, MMR is measles, mumps, rubella, pneumococcal, hepatitis A, HPV, which is for cervical cancer, herpes zoster, and Tdap. So these are the basic vaccines which every adult should be taking it. Now we will discuss on that, which are very important to be taken, which can be definitely ignored if in case you want to take, because like hepatitis A, I don't know, hepatitis A is everyone aware that hepatitis A is like in India we call jaundice. Jaundice जैसे हम लोग बोलते हैं कि jaundice हो गया, पीलिया हो गया है, we call viral hepatitis. So viral hepatitis is hepatitis A. Now that vaccine, if in case you miss it, you might get infected with jaundice. But jaundice is, it can be life threatening. I'm not saying no disease, but jaundice are normally can be taken care. It takes 1 month of 1 to 2 months of medications. Maybe some people require hospitalization, but a one vaccine might have helped you to save that from that hospitalization. Definitely, it is not that life threatening disease, but hepatitis B, once you get infected, you'll be suffering lifelong. You'll be suffering lifelong. So why don't you people think that how important to take one vaccine? And if we get infected, we are going to suffer lifelong. We have to visit doctor lifelong. We have to give medicines lifelong. You have to keep doing blood tests, investigation lifelong. uh, uh, if people are not aware of, I just want to tell you, I don't know, Amitabh Bachchan, if you must be knowing him, he's suffering from hepatitis B. So during when he got, I think he met an accident during the this movie Coolie, and I think he was almost battling from life. He was given a lot of blood transfusion, and blood also is always checked for hepatitis B and HIV. But by mistake, I don't know, he got infected from one of the blood transfusion from hepatitis B, and he's still suffering from hepatitis B. He's still taking the medicines for hepatitis B. So now we as an individual, normal, common person spending so much of money for treatment, why should not we spend some money? Because this is a saving for us. So we would be using our adult vaccination as a saving for us. It's a health saving, especially. So that is why it is very important for us to understand the vaccine. Now we will just go very fast. I will not take much time in vaccines. I will not spend a lot of time ki how these vaccines work, which of the vaccines are there, because we will tell you the start to everyone who requires at the end ki what everyone requires the vaccine. And if in case they want to take a vaccine, we can still, that can be managed if on the individual basis. But we will just go fast with what kind of vaccines are there for adults. Because last time I gave my session for adult vaccination, a lot of people came to me. Well, we were not aware of are there any vaccines for adults. Our doctors never told us. So this is the information, that first clear information, there are a lot of life-threatening diseases are there, which every elderly person is at risk of getting it, and we can save ourselves from taking a vaccine. So the first vaccine is Tdap. So Tdap has protects you. Tdap protects you from three kind of diseases, which is diphtheria, tetanus, and pertussis. In tetanus, if you get a tetany, your muscles gets very weak. You lot of people, they can't talk later. The muscles, if I'm talking, I'm using my muscles. My muscles have energy. If my muscles will not have energy, I'll not be able to talk after a minute. So there are a lot of diseases. Once you get infected, you have to spend a lot of money in treatment, and you never, there's lot of time it is, there are chances you might not recover also. So efficacy of Tdap vaccine is 92%. So why I want to use it word efficacy? Because very soon, abhi everyone is listening about COVID. कि भाई efficacy means the benefit. So it means अगर 100% लोगों ने वैक्सीन लगाया, 92% लोगों को they will never get infected. So that is the efficacy, that because why I want to say this word efficacy and give you the information, because lastly, if in case we discuss about COVID, there are vaccines for COVID which are going to come with the efficacy of 70 to 80%. That we'll discuss. So Tdap is basically you have to take 2 doses of Tdap vaccine for use who are more than 10 years of age. Okay, that is one. And recommendations is for all adults who have not received Tdap or for whom vaccine status is not. So every adult, जो भी adult है उन्होंने अगर बचपन में Tdap नहीं लिया, so they have to take 2 doses. And if any adult who have taken vaccine of Tdap in his childhood, he has to take 1 dose of Tdap in this age. So irrespective of you have taken in childhood or not, this Tdap vaccine is mandatory in adult age of 35 plus. You can take 35, 45, 55, 65, 75. Any age criteria, this Tdap vaccine has to be taken, because it protects you from three kinds of diseases, which is diphtheria, tetanus, and pertussis. Or this all three diseases are they are that significant. इनमें से अगर एक disease हो गया, if you suffer, you have to get yourself hospitalized. So instead of spending 10 days in hospital, they might not be life threatening. Pertussis, they might not be life threatening, but they bother you for days and months. So how important is this? We will now shift to another vaccine, which is MMR vaccine. It is measles, mumps, and rubella. Again, it is a combination of three diseases. MMR vaccine has been very important part of vaccination for children and even for adults, because I feel every adults, they suffer at least one of the three diseases in a regularly routine. So this vaccine save you from the disease. It lifelong saving is. Even during the COVID times, there was a small research done in US, and it was told that even MMR vaccine, and it was told that why children are not getting affected from COVID. Like like COVID के लिए, for my information, I've spoken to a lot of pediatricians from Jahangir, Ruby, or other doctors. Not even a single kid have gone to ICU after suffering from COVID. The whole ICU was full of COVID adults, but not even a single kid. And then after the discussion, we found the reason for them not that COVID not able to bother them. One of the thing is was MMR vaccine, BCG vaccine. So children who got MMR vaccines, they were protected from COVID. They got COVID. They got infected from COVID. Even a 2 years old child got infected from COVID. 5 years old child got infected, but they did not. It did not become so serious that any kid had to get admitted or they had to go to ICU. So MMR vaccine, it is same. It saves you. It is for the adults also. I, as a doctor, physicians, I took a booster of MMR in the month of May, just because that I should be protected from the symptoms of COVID. It is not definitely not for the COVID, but MMR itself has their own lot of benefits to save you from mumps, measles, and rubella. There are two kind of vaccines in all over there. The one vaccine is life attenuated vaccine. What it means is life attenuated vaccine is the life strains of that bacteria or virus is put into the vaccine, and it very small number of bacteria are being injected in our body, and our body suddenly develops the antibody to fight with that bacteria. The bacteria injected might be very small number, but the antibody developed is so high that it remains in the body for long time. And if in case you get infected from any of the disease later, the body already has that defense system developed ready for in the body. So as soon as you get infected from any of disease, the defense system suddenly kills that virus or bacteria before it damages any organ of your body. So this is how the vaccine works. So normally, lot of most of the vaccines are live attenuated vaccines. So they are the live organisms are being injected in your body through the vaccine. So MMR vaccine is administered subcutaneously in the arm, upper arm. It's very easy to use, it's very easy, not painful, does not have any kind of symptoms. So it is very important vaccine. It has a single dose. It should be taken by every adult. If not taken since last, if in case if taken only in childhood also, you can still take it. What are the indications are that adolescents and adults and women of childbearing age who is not pregnant also can take MMR vaccine, but a pregnant woman can't take it because the life organisms have been injected in their body, and the immunity of pregnant females are less at that moment. So, so they might not able to fight with that organism. Frequencies are one dose now, and you can repeat the vaccines after 4 weeks, and again it can be that is how told you it can be taken subcutaneously in upper arm. So MMR is also a very important part of vaccination for adults. It is very mandatory, at least one dose, and it can be taken. A repeated booster can be taken after 28 days of first vaccine. Varicella, which is chickenpox. Chickenpox, everyone is aware that chickenpox. They say कि बचपन में almost सबको everyone suffers from chickenpox once at least in lifetime, not in the childhood, once in the lifetime. So, and once if you achieve the once you get infected from chickenpox in childhood, if you can see the photo, if you, people are not aware chickenpox, what is chickenpox? We get a lot of red rashes, itching, irritable rashes in the face, and it is highly infectious. तो अगर घर में एक को चिकन पॉक्स हो गया, and if any other who have not taken vaccine, they are risk for getting chicken pox. And chicken pox, that 3 weeks are so irritating, are so difficult to live in that 3 weeks, so with so difficulty. So it is always safer that if you take a chickenpox vaccine instead of facing that issues. Suppose if you have kids in your house, you get infected from chickenpox, you'll be kept isolated, you'll be sent to hospital, that the other kid might get infected. So you not only you get infected, you know you suffer that kind of difficult situation, that how you'll manage, how will other people will manage. So taking a single dose of vaccination, normally it is at two doses is there, but even a single dose can also benefit you. So basically that are also a live attenuated varicella virus. So chickenpox is very common. If no one has faced in lifetime, he is always at risk for chickenpox. It is not that if you have had chickenpox in childhood, you will not get it, but there are less chances that you will get it. We have seen a lot of recurrent cases. We have seen a lot of people who have got again, but the chances are very less. It will be like one in 100 will get a repeat or recurrent chickenpox infection. So this is a very common disease in India. If anyone who have not, and if you have even got chickenpox, you can still take a vaccine, so then it becomes sure that you will not get infected again. So basically all susceptible adults should be vaccinated from the age of 18 to 49. It is minimum, and even later also they can take if they have not got infected. Okay, healthcare workers are risk, family contacts of immunocompromised persons are risk. If you're diabetic, if your immunity is low, you are always at risk. So everyone at some area are always at a risk for chickenpox. So this is a very important vaccine and common vaccine. uh, HPV is for a cervical cancer, it is for female. uh, Basically there are two types of HPV is there. This normally vaccines, as a physician uh, we don't prescribe to our patient more, because normally it has been prescribed the gynecologist. So it is even for male which can transfer it to the kind of thing. So basically human papilloma virus vaccines are available. So basically Gardasil and Cervisic, there are two companies which are available in India, which is also one of the important, and it saves you from the cervical cancer. Hepatitis B. If you can see the photo in the, I don't know if you are able to see that. If you can see the photo of the infected liver, hepatitis B is what we discussed, that the vaccine which is very important. Once you get infected with hepatitis B, you will never be treated, or you can't recover from that disease. It will be a lifelong disease. You'll have to keep on monitoring yourself. Liver becomes always at risk. I don't want to scare that you might go into liver failure or maybe a lot of other things, but then continuous monitoring and lifelong precaution is required. So it is important. If you take vaccination, you'll be saved it, because it is very easy to get hepatitis. You can get it from blood. Elderly people who go for blood transfusion, they can get infected from blood. Healthcare workers who treats patients, who comes in contact with patients, if any person who is hepatitis B positive can infect to other through blood, not directly. You can't get it from touching. But suppose if there is a hepatitis B patient have got some kind of bleeding, and you also have cut in your hand and you touch that, so that blood also can infect your body. So doctors are at risk. People who are taking blood transfusion at risk. So it is always important. It is very important. Now, for hepatitis B, it has a protocol of three vaccines. It has to be taken a gap of uh, 0, 1, and 6. So 0 means if you take the first vaccine on today, after one month will be the second dose, and after 6 months will be a third dose. So that together saves you, or protects you from getting infected from hepatitis B. So hepatitis B is very important, because once you get infected, it will be very difficult for the treatment. So this is very important vaccine for the adults. Further information like booster dose of once you have taken hepatitis B, once you have completed your dose of hepatitis B, even if you are age of 15, 18, 25, 40, you have to take, you can't, you have to take it. It is not only adult, that late elderly, any age has to take it. And once you take, it is 99% lifelong precaution from hepatitis B. So it is always important, once you take the complete dose of hepatitis B vaccine, you remain lifelong protected from hepatitis B. Hepatitis A, that is what I told you. Hepatitis A is viral hepatitis, which is called normal jaundice. You can get infected from food, water, infected water. So basically, there are two doses of 1 ml at a gap of 6 months, and definitely because it saves you from hepatitis B. If you're traveling, if a lot of students who are traveling for studies abroad at the age of 17, this is a mandatory vaccine. Hepatitis A, hepatitis B, MMR. So these are all mandatory vaccines for that, because in India we don't follow that protocol. But USA, European countries, they strictly follows even insurance, and they sponsor that vaccines for the patient. Because see, if you're this is again kind of insurance. When we as a normal person spend money on health insurance every year, just thinking कि कभी बीमार होंगे तो तब काम आएगा, हो सकता है 5 साल बाद बीमार होंगे, but every year you pay the health insurance money. So why not spend some money in your vaccination? That is again kind of a health insurance for you. And health insurance में तो क्या होता है, बीमार होने के बाद हॉस्पिटल जाना पड़ता है. You have to anyway suffer, तकलीफ तो होएगी, टाइम तो लगेगा, बीमारियां तो होएगी, दवाइयां तो खाना पड़ेगा. Then the health insurance helps you to pay the money. But here this vaccination, they save you from the diseases, they save you from the suffering. Yeah. So hepatitis B is just a jaundice. There are vaccines available. There are 2 doses available. So this also a mandatory vaccine for the adults. Very important vaccine. Now we move forward to one of the most important vaccine, which in this year, in this era of COVID-19, we have given a lot of pneumococcal vaccine. It is not that it became important in the phase of COVID. It is very important because in not only in India, in US, European, there are thousands of deaths every month with pneumonia. And it is a very deadly, it's a life-threatening disease. The mortality is high in pneumonia. And I don't know here in India, but pneumonia vaccines have been there available since years. It is not that only with the age of 18, but there are two kind of pneumonia vaccines. One is pneumococcal PPV, it's a polysaccharide vaccine, and one is a PCV, which is a polysaccharide vaccine. Now, we don't want to go into much of a deep because, but when we say PPV 23, so there are 20 serotypes. There are multiple serotypes where you can get infected. That is the reason. So PPV 23, it saves you from 23 kinds of serotypes of pneumonia. So if a person who's more than 50, he should be taking PPV 23, and a person who's from 18 to 49, he can take a PCV in addition to flu vaccine. So pneumonia vaccines are very important. If we are at age of more than 50, only one PPV 23 saves you from pneumonia. And if in case like in era of COVID, we say if you get infected from COVID, the deaths happen due to pneumonia. So it doesn't say that this vaccine will save you from not getting infected from COVID, but it can save you from the deaths happening through pneumonia. So COVID causes pneumonia, and if you're already vaccinated, you might save yourself from getting into deeper issues with pneumonia. It's a single standard vaccine, 0.5 ml, administered by intramuscular or subcutaneous. If in case high risk people who are there, who already have lung diseases, who are in a place where a lot of people are having lung infection. So if in case only who are at high risk, they can repeat the vaccine after 5 years after first dose, but only in case of high risk people. A normal person can take only one vaccine and save himself or get protected himself from pneumonia. And as we talk about pneumonia, it is very important for me to talk about the influenza. Influenza is not something, it is just a flu vaccine. People suffering every year from cold, fever, respiratory infections. Influenza not only protects you from common flu, it also protects you from swine flu. So all kind of swine flus or all kind of flus have been protected by influenza vaccine. So even flu, but this vaccine is not has to be taken every year. It is also a very important vaccine because respiratory deaths are there, very common, people suffering from flu, swine flu. So respiratory deaths are very common. H1N1, it also, so H1N1 is a swine flu. It protects you from swine flu also, but it has to be taken every year. Now there are two modes of taking this vaccine. Is one is injectable and the other mode is a intranasal. We as physicians don't prescribe more of an intranasal because some study says that it is not that effective because sometimes you're due to some kind of blockages or polyps, the when you put that intranasal vaccine, it is easy to take, it does not, you don't need to prick it, but sometimes due to some polyps or the vaccine does not go inside and you don't get benefit of that vaccine. So we have found that the number of research that says that once you take the vaccine inside, it is beneficial, but there are chances that it might get blocked somewhere and you might not get the benefit of intranasals. And if a person who's giving you is not very much uh, compliant or is not knowledgeable how to give it, and if he makes a mistake, you don't get the vaccine very properly. So we don't much of a prescribe or we advise to take an intranasal, but it is available in the market, and it's a other vaccine is a uh, intramuscular vaccine. Meningococcal meningitis. This vaccine is, I think, is not aware in the Indian public because but there are a lot of uh, brain fever when we call meningitis is there, because meningitis is not a common disease, but if it happens to anyone, it is more of a life-threatening disease. So basically, it does not induce herd immunity, okay? But then if in case you take a vaccine, you are safe from a deadly disease, which is a meningococcal meningitis, because the brain gets infected and you get a brain death. It's like brain fever. A lot of people say brain fever, brain kind of brain infection, because this word is not that common, meningococcal meningitis in India, because a lot of doctors, when they tell patients that your patient had got a brain fever, he had got a lot of fever. There are cases I have seen that a young patient had a fever. He was sent home with the medicines, and just while eating food, he suddenly collapsed with that kind of attack with the meningitis, and he could not be survived. So disease is deadly, not very common, but definitely it is also very important because it is a life-threatening disease. People who are traveling to People who are traveling, going abroad, who will be staying, or who have congenital deficiencies of brains or something, have are very important, should take it. Now, what we do with the adult vaccinations, we make a chart of the adult vaccinations, we provide that date vaccinations, we provide next dose available, we give them the details of which vaccine you took. So then what happened as a kid, which we used to maintain that chart and show it to our doctors that this is my vaccine chart. Now adult vaccinations, we are making the charts for adult vaccination, providing them the proper vaccines, time to time basis, and so this is what how we have developed the adult vaccination, and it is same as we used to take in our childhood. What is important during vaccination is healthcare personnel who comes to give vaccines are trained before administering vaccine. They are informed about the effects and side effect of the vaccine. So when they give the vaccine to the patient, they tell the patient that you might get headache, you might get fever, you might not get it. So they are well aware of where the vaccine should be given, what is the right dose, what is the right place. So then you don't face a lot of pain after vaccine. So these are all the kind of things. This is a just small chart which I've just told you that vaccine and age group. If you see in the chart, 19 to 26, 27 to 49. So Tdap is important for every age. Varicella is 2 doses for every age. Zoster is for 1 dose after the age of 60, 65. MMR 1 or 2 doses till the age of 49, but after 49, uh, you have to take 1 dose. Influenza 1 dose annually. Hepatitis A 2 doses is common all the age criteria. Hepatitis B is 3 doses and meningococcal is 1 doses. So basically every vaccine is dependent on the indication and contraindication as per the patient's history, whether patient is suffering suffering from any kind of liver disease. So can he take this vaccine? Can he take the vaccine or not? Whether patient had already suffered from disease, so can he really take one dose or two doses? So this basically this is how we follow the protocol. But today our program our focus was just to give you a brief view that really there are adult vaccinations available. How much important, I want to tell you it, how much it is really very important for every adult to know it and follow the protocol of adult vaccination. If you want to save yourself from pneumonia, there's only one vaccine lifetime. We have not covered a lot of other vaccines like anti-rabies, which comes from a dog bite, because it is not a mandatory vaccine. That vaccine is just because कि dog bite हुआ तो vaccine लेना है. So we have not included a lot of other vaccines. Tetanus का जो एक, there's a regular tetanus. We have even talked about the DTaP, which has a booster dose. But routine tetanus is if you take it if you get infected from any kind of iron or rusted iron, then only you do. So we have not covered optional vaccines. These are the mostly vaccines which are more of a mandatory vaccines. इसमें एक दो vaccines है, if you don't take it, it is fine. But 90% of the vaccines every adult should be taking it. So I just complete it, so then we can have 10 minutes in terms of discussion on the vaccine part, or any queries you have for the vaccines, please let me know.
Thank you so much, Dr. Mukesh. Thanks a lot. This was very comprehensive, but yet very well informed, and I'm sure this has given a lot of information in a very simple language to our members. So, anyone has any question, they can unmute and ask Dr. Mukesh. You have to just unmute from your mobile, and if you have any questions, you can ask Dr.
Dr.
Mukesh.
Mukesh,
Yeah.
I'm Shukla Advocate Singh from Pune.
Yes, sir.
Is there, there was in your chart, I could see a vaccine for herpes.
Herpes, yes. Herpes zoster.
Herpes zoster. Is it available?
Sir, herpes zoster, Zostavax, there's a vaccine which has been due to, I think in this COVID times, there's a vaccine is definitely available. Vaccines are there, but in this due to COVID times, the vaccines were in very short, and that is the reason kind of thing. But herpes zoster, Zostavax vaccine is available. Okay, I think you can see here on the chart which is open and Zostavax. Okay, so it is available. It is also very important. Herpes zoster again is a if in case everyone is aware of, it's a nerve medicine which can affect from your skin organ to your brain to your eyes. Definitely it is not a lifelong disease. It can be treated with the help of medicines with a course of 5 to 8 weeks maximum. It can give you a lot of nerve pain, body pain. So vaccines are available. Definitely it's a single dose vaccine available, and it is definitely available. Herpes zoster is very, in India. We don't. It is not coming in the Indian chart till now. It has not taken a space. I don't know why, because we have been struggling for our patients time to time for flu vaccines, pneumonia vaccines, hepatitis B vaccines. कि कई बार क्या होता है, if patients come to know and if we start doing charting of their कि अभी आपको 11 वैक्सीन लेना है, patient will never come back to me. अरे डॉक्टर ने तो मेरे कोई भी डॉक्टर ने वैक्सीन नहीं बताया. So we go with the priorities, hepatitis like pneumonia vaccine, hepatitis, flu vaccine, and in the COVID area, flu vaccine and pneumonia vaccines have because during this phase, pneumonia and flu vaccines is where we have actually offered to our patients.
Okay.
So that
So,
is the reason why
excuse
we
me.
not take herpes zoster too much, kind of into consideration, because it is not a life-threatening disease.
But at the same time, what I'm observing is many of my friends got affected with herpes. So since I saw it in your chart, I was interested to know whether it is available in Pune.
Sir, Abhi, there's a shortage because we had got some kind of thing, but that will be soon available from next month. Now there are two kind of herpes, sir. Actually I don't know, because a lot of people there's herpes simplex virus, HSV, and there is one herpes zoster. So herpes simplex virus is a very common, and lot of people are suffering from that. That is again a disease which is STD, which can sometimes come, which it is come into a STDs also, which is sexually transmitted disease, HSV. It is a very common disease in US. Definitely, so that says if you get infected, you might infect to others, and then you might keep on infecting others, and it does not it does not get treated very easily. It takes years or months to get treated. So
May I ask a question, please, Doctor?
Yes, sir. Please.
This is Gureja here.
Yeah.
If I understand right, the burden of this your talk was that in view of the COVID pandemic, it would be a good idea to have these vaccines which have not been taken by people earlier, in order to avoid complications which might occur in case one catches COVID-19 infection. Am I right? Is that the burden of your talk, or whether
No,
even
sir.
otherwise you recommend that?
No, sir. Last year before COVID also, I think, or not last year, I think before 2 years back, we also gave the same adult vaccination seminar with our senior citizen members. And I practicing, I follow this protocol of vaccination since years.
Okay.
Since years, and and sir, I am really thankful to take that question out, because if my message is not clear, I want to tell it is not only COVID. During COVID, you should be thinking of this vaccine. Ki COVID khatam ho gaya, ab nahi. And I thank you again.
Okay.
This vaccine is very important for years. So there is no connection of COVID. I was trying to, some vaccines I was trying to connect with COVID, just to keep that information, that pneumonia. And that is what I'm saying, because people came to me,
Right.
you're advising pneumonia, but isse COVID nahi hoga kya? Nahi, I said COVID you will get it, but the complications will be reduced. So that was just a different information, but not like that after COVID is over, this has no role.
Okay. Thank you.
Yes, sir. Welcome, sir. So definitely, if in case we will try to provide you a chart, anyone having more queries, you can contact Rajiv. He will take all details of yours. We will provide all chart details to you. For Pune, of a lot of members, we have actually I personally, as my own patients, it is not now, if my patients who have been listening to me, they are aware that I have been pressurizing them to take flu vaccine, pneumonia vaccine. Definitely on COVID times, I definitely pressure them more, but I feel I know the importance of this vaccine, and I want to just pass on that information, that how important this vaccine is for you all people.
Yeah, and at Pune, you have helped us a lot, Dr. Mukesh, in administering these vaccines in batches to our members. From there, we actually have done that in Calcutta also. So all around 28 members following the same thing, we could, provide them with that schedule of vaccinations what you had given in consultation to our physicians in Calcutta.
Very good.
So they also have said the same thing. Yes, तुम लोग अगर करके दे सकते हैं तो nothing like it. Please do it.
And I understand that importance, and I feel that this benefit is there available with a it's not that expensive that no one can afford, but it saves you from lot of problems, lot of diseases. So I would say that if you want, if you still have confusion, think about that. But if you're clear, please go ahead. If you have your own physician, you can go to your physician. We are there to provide the help, but please take the benefit of the vaccines available in the market.
Any more questions from any of our members?
Rajiv, could as Dr. Budhwani has suggested,
Yes.
There is some kind of a printed note which talks about the vaccine regimen, regimen. So could we get a copy of that so that one can then accordingly consider and decide whether to go through this, or which are the ones which one picks up and consult a doctor and then take that?
Yeah, so Dr. Mukesh, you showed a chart which is like
No, no,
mandatory. So
what
if you can
what
send that on WhatsApp
no, no, right.
to
Yeah,
me,
you collect whatever the email IDs and whatever the numbers you have. We will once after this, we'll just within this week, what we'll do is we'll send a proper information to everyone. Okay, according to whatever the details, what vaccine they should be taking it mandatory.
yeah, so that's what I'm saying, that we have a full WhatsApp group of Kolkata members and Bombay Pune members. So once you give me those thing, I remember you gave me once earlier after our 2018
Yes,
talk.
yes,
The same schedule and the chart, if you can give, I'll circulate in that group.
yes.
And then like we did last time, we'll coordinate for all the members who are interested, and again we'll take your help in getting it administered there
No, no,
in.
because I'm always think like even now as per the COVID, we are trying to get more information, collect the information for COVID, and as soon as all the informations are out with us, we will be going to have one session on the COVID vaccine,
Yes.
and we will be trying to see how soon we can make it available. If government is making available for our senior citizens, fine. We don't know how it will happen, but we are still also in touch with the Serum Institute that how we can get some vaccines for our members as soon as possible, and we can provide them at home. Okay, but that is still in a very early phase because they themselves are not aware how they will be providing. As I told my some of my members that I personally have taken a COVID vaccine from Serum Institute, and we are getting all the data from there also. So as soon as things get start, will be more clear how you develop antibodies, how long that vaccine will benefit. If in case you get a side effect, what you should be doing it. So there are a lot of queries. So we would like our members before the COVID vaccine starts actually to get all the information of the COVID vaccine.
Budhwani.
So thank you so much. That is like a great relief for all of us. Thank you, Dr. Mukesh.
Yeah, this would be nice, Rajiv, if
Yeah.
on COVID particularly, and if Dr. Mukesh could give us some kind of his view, an overview of whatever is the status now of the forerunners in COVID vaccine. Uh, that would be very useful. And what are Dr. Mukesh's own kind of own estimation of how soon uh, would any vaccine be available? I mean, I know it's very difficult to fix a specific period, but Dr. Mukesh would have better insight into that if
Sir,
he
sir,
could
for
share.
the information right now, I can tell you the vaccines with the Serum Institute who have made with the coordination of Oxford, UK, and AstraZeneca. The vaccine is ready now. Vaccine is ready.
Okay.
I personally have taken the ready vaccine now. The only thing is there's a lot of government rules and regulation which and Poonawalla have been very ethical with all the process that they are not making this vaccine as kind of a business thing. They want this vaccine to go for the people. Just they don't want to make it a more of a profitable kind of thing.
Yeah,
So,
that is very nice of them. I have heard the Dr. Poonawalla,
yes, yes,
Adar Poonawalla talking
yes,
about this,
yes, yes,
and I can imagine that's their
yeah.
it's a good way of
So
thinking.
they were waiting for the government. So I think everyone is aware. Yesterday, PM Modi he
Yeah,
visited Pune.
right.
So after this, now a lot of things are clear with them. I think Adar Poonawalla, there was an interview later in the evening also in a lot of TV channels. You people have
Okay.
must have seen. So it's the first time he gave the proper interview information. So only
Yeah.
information I can give you now, two things is one is vaccine is ready, which can come anytime in these 2 months if all the rules and regulations have been processed very fast because they
Okay.
have applied for an emergency. Normally, once vaccine is ready, they take 6 months to get that license to sell, but they have applied for an emergency, which they are saying in 3 weeks. So one thing is vaccine is ready. Other thing, there will be two doses of vaccine. One will be like if you
Hmm.
take today, the second booster dose will be after 4 weeks.
Okay. So the fact that you have yourself taken that
Yes.
is a measure of your confidence in that. Yeah. Okay.
Yeah.
Thank you.
Yeah. Thank you, sir. Thank you.
Okay then.
Any more questions from any of our members for Dr. Mukesh? Else, else we will conclude today's program. So, Dr. Mukesh, once again, thank you. As usual, you have always been giving us good information. You have created a lot of awareness about several diseases and also the prevalence and prevention in our earlier chai time programs, which we used to have in person. We will work very closely with you in terms of providing the information and the schedule and the chart to all our members in both the groups, and then also we'll work towards creating batches to provide them with the vaccination, whoever is interested. And towards the end of December or early January, whenever you feel the information is available with you, we will have a separate program on COVID vaccination.
Absolutely. And thank you very much
Okay.
for listening in
Yeah, thank you
patiently.
very much.
Thank you. Thank you.
Yeah, thanks a
Yeah.
lot, sir. Thank you. Have a
Is
nice
this
evening. Yeah.
Is this Dr. Mukesh Budhwani or Budhrani? I'm not in a position to read.
Dr. Mukesh Budhwani, he is from Apollo
Budhwani.
Clinics, Pune.
Okay. Thank you very much, Dr. Budhwani. Yeah.
Yeah. Thanks to all our members. Thanks, Dr. Mukesh. Bye bye. Have a nice evening.
Bye.
Same to you. Have a nice weekend.
Thank you. Thank you.
So it was nice talking and listening to Dr. Mukesh. Again, I'm also confused. Budhwani, right?
Budhwani, yes.
Budhwani. Anyway, it was quite informative. And we are waiting for that chart you'll be sending, right?
Yes. I'll work with him to. He has to just send it to me on WhatsApp,
Yeah.
and I'll circulate it in the groups.
Sure. Thank you very much. Okay. Bye bye.
Yeah. Thank you. Bye bye.